Question 311. Which of the following laboratory values would be the most important to monitor for a patient with pancreatic cancer? A. Serum glucose. B. Radioimmunoassay, RIA. C. Creatine phosphokinase, CPK. D. Carcinoembryonic antigen, CEA. Question 311 Answer. A serum glucose. Question 311 Explanation. In pancreatitis, hypersecretion of the insulin from a tumor may affect the islets of Langerhans, resulting in hyperinsulinemia, a complication of pancreatic cancer. Options B and D should also be monitored to measure the effects of therapy, but hypoglycemia may be life-threatening. Creatine phosphokinase is an enzyme that reflects normal tissue catabolism. Elevated serum levels indicate trauma to cells with high CPK content. CPK and CPK enzymes are used to detect a myocardial infarction. Question 312. You observe changes in mentation, irritability, restlessness, and decreased concentration in a patient with cancer of the liver. Hepatic encephalopathy is suspected and the patient is ordered neomycin enemas. Which of the following information in the patient's history would be a contraindication of this order? A. Left nephrectomy. B. Glaucoma in both eyes. C. Myocardial infarction. D. Peripheral neuropathy. Question 312 Answer. A left nephrectomy. Question 312 Explanation. Neomycin prevents the release of ammonia from the intestinal bacteria flora and from the breakdown of red blood cells. Common side effects of this drug are nephrotoxicity and ototoxicity. Patients with renal disease or renal impairment should not take this drug. Peripheral neuropathy, option D, is a chronic complication of diabetes mellitus. Options B and C are not affected by neomycin. Question 313. A nursing intervention for a patient with hepatitis B would include which of the following types of isolation? A. Universal precautions. B. Blood transfusions. C. Enteric isolation. D. Strict isolation. Question 313 Answer. A universal precautions. Question 313 Explanation. Universal precautions are indicated for the patient with hepatitis B. Hepatitis B is contracted via blood and blood products, body secretions, and punctures from contaminated needles. Question 314. A patient is admitted with lacerated liver as a result of blunt abdominal trauma. Which of the following nursing interventions would not be appropriate for this patient? A. Monitor for respiratory distress. B. Monitor for coagulation studies. C. Administer pain medications as ordered. D. Administer normal saline, crystalloids as ordered. Question 314 Answer. C. Administer pain medications as ordered. Question 314 Explanation. Pain medication may mask signs and symptoms of hemorrhage, further decrease blood pressure, and interfere with assessment of neurologic status and additional abdominal injury. Question 315. A male client is recovering from a small bowel resection. To relieve pain, the physician prescribes mepridine, Demerol, 75 mg IM every 4 hours. How soon after administration should mepridine onset of action occur? A. 5 to 10 minutes. B. 15 to 30 minutes. C. 30 to 60 minutes. D. 2 to 4 hours. Question 315 Answer. B. 15 to 30 minutes. Question 315 Explanation. Mepridine onset of action is 15 to 30 minutes. It peaks between 30 and 60 minutes and has a duration of action of 2 to 4 hours. Question 316. For a client in hepatic coma, which outcome would be the most appropriate? A. The client is oriented to time, place, and person. B. The client exhibits no ischemic areas. C. The client increases oral intake to 2,000 calories day. D. The client exhibits increased serum albumin level. Question 316 Answer. The client is oriented to time, place, and person. Question 316 Explanation. Hepatic coma is the most advanced stage of hepatic encephalopathy. As hepatic coma resolves, improvement in the client's level of consciousness occurs. The client should be able to express orientation to time, place, and person. Ischemic areas are related to decreased synthesis of clotting factors. Although oral intake may be related to level of consciousness, it is more closely related to anorexia. The serum albumin level reflects hepatic synthetic ability, not level of consciousness. Question 317. Jordan is a client with jaundice who is experiencing pruritus. Which nursing intervention would be included in the care plan for the client? A. Administering vitamin K subcutaneously. B. Applying pressure when giving IM injections. C. Decreasing the client's dietary protein intake. D. Keeping the client's fingernails short and smooth. Question 317. Answer: D. Keeping the client's fingernails short and smooth. Question 317. Explanation: the client with pruritus experiences itching, which may lead to skin breakdown and possibly infection from scratching. Keeping his fingernails short and smooth helps prevent skin breakdown and infection from scratching. Applying pressure when giving IM injections and administering vitamin K subcutaneously are important if the client develops bleeding problems. Decreasing the client's dietary intake is appropriate if the client's ammonia levels are increased. Question 318. Marie, a 51-year-old woman, is diagnosed with cholecystitis. Which diet, when selected by the client, indicates that the nurse's teaching has been successful? A. 4-6 small meals of low-carbohydrate foods daily. B. High-fat, high-carbohydrate meals. C. Low-fat, high-carbohydrate meals. D. High-fat, low-protein meals. Question 318. Answer: C. Low-fat, high-carbohydrate meals. Question 318. Explanation: for the client with cholecystitis, fat intake should be reduced. The calories from fat should be substituted with carbohydrates. Reducing carbohydrate intake would be contraindicated. Any diet high in fat may lead to another attack of cholecystitis. Question 319. The hospital administrator had undergone percutaneous transhepatic cholangiography. Which assessment finding indicates complication after the operation? A. Fever and chills. B. Hypertension. C. Bradycardia. D. Nausea and diarrhea. Question 319. Answer: a fever and chills. Question 319. Explanation: septicemia is a common complication after a percutaneous transhepatic cholangiography. Evidence of fever and chills, possibly indicative of septicemia, is important. Hypotension, not hypertension, is associated with septicemia. Tachycardia, not bradycardia, is most likely to occur. Nausea and diarrhea may occur but are not classic signs of sepsis. Question 320. When planning home care for a client with hepatitis A, which preventive measure should be emphasized to protect the client's family? A. Keeping the client in complete isolation. B. Using good sanitation with dishes and shared bathrooms. C. Avoiding contact with blood-soiled clothing or dressing. D. Forbidding the sharing of needles or syringes. Question 320. Answer: B. Using good sanitation with dishes and shared bathrooms. Question 320. Explanation: hepatitis A is transmitted through the fecal-oral route or from contaminated water or food. Measures to protect the family include good hand washing, personal hygiene and sanitation, and use of standard precautions. Complete isolation is not required. Avoiding contact with blood-soiled clothing or dressings or avoiding the sharing of needles or syringes are precautions needed to prevent transmission of hepatitis B.